Hi guys, welcome again to Pathology in a Nutshell. I remain Dr. Ben. Today we are going to be talking about intracellular accumulations and pathologic calcifications. Sometimes certain biochemical or even structural changes can lead to the accumulation of substances within a cell. These substances, when they accumulate, may be harmless, but most of the time they are harmful. And there are majorly four reasons why substances accumulate in the cell. Okay, the first one is when there is inadequate removal of normal constituents of the cell, of normal cellular constituents. Okay, and usually this is as a result of defects, maybe because of defects in packaging or transport. Okay, so in this case, the constituent that is accumulating is actually a normal product of the cell. But because there's a problem with packaging that constituent and transporting it, okay, they will not be removed efficiently. And so as they continue to be produced, they remain in the cell and they accumulate within the cell. And one classical example is steatosis. Okay, now the second reason why cellular constituent may accumulate in the cell is because of accumulation. There's accumulation, okay, due to defects in folding. So these proteins are misfolded, and that's why they cannot be excreted. Okay, so because they are misfolded, they accumulate in the cell, and their misfolding makes it difficult for them to be excreted. Okay, that is the second reason. And an example is seen in alpha-1 antitrypsin deficiency. Alpha-1 antitrypsin deficiency. The third reason is due to defects in metabolism. Okay, so in this case, the products are supposed to be metabolized, but most likely because there's a defect or there's a deficiency in the enzyme that should have metabolized those constituents, they will remain in the cell. So the defect in metabolism is usually as a result of what? Of enzyme deficiency. Because of enzyme deficiency. Okay? And we see this in a lot of lysosomal storage diseases. Okay, so defects in metabolism, enzymes are not available to metabolize those substances. And the fourth reason is when exogenous substances accumulate. Okay, exogenous substances accumulate, and the cell does not have the machinery to handle those endogenous substances, to degrade them or to metabolize them. Okay, so those exogenous substances will accumulate within the cell. And an example where we see this is we see it in anthracosis. Okay, so these are the four major reasons why constituents accumulate or why substances accumulate in the cell. The next thing we'll be looking at is what are those substances that can accumulate within the cell. So what are those substances that can accumulate within the cell? Okay, lipids can accumulate within the cell. We have lipids. Proteins can accumulate within the cell. Proteins can accumulate. Carbohydrates particularly glycogen, can accumulate, and even pigments can accumulate. So these are the major things that can accumulate within the cell. And among lipids, we can have triglycerides. Triglycerides can accumulate within the cell, okay? And we see triglycerides accumulating in steatosis, okay? We have mentioned this before, steatosis, where it can accumulate in the liver, it can accumulate even in the kidney, it can accumulate even in the heart, okay? And the reason for that, it may be as a result of toxins, okay? Steatosis can happen because of toxins. It can happen because of nutritional diseases. Steatosis can happen even in ischemia, or let's say hypoxia, okay? It can also happen as a result of alcohol. These are some of the things that can lead to or that can cause steatosis. Another lipid that can accumulate is cholesterol. Okay? Cholesterol can accumulate in conditions like atherosclerosis. Of course, we know that where there's cholesterol deposition after they have been phagocytosed by macrophages, they are deposited in the wall of blood vessels, and that can lead to vascular diseases, vascular occlusion. Okay, so we see cholesterol accumulating in atherosclerosis. Cholesterol can also accumulate in xanthomas, okay, where there's accumulation of cholesterol, okay, and phagocytosed by these macrophages, and they are deposited in the subcutaneous tissue, and sometimes you will see them like masses, okay, within in the subcutaneous tissue. That is xanthomas. Cholesterol can accumulate in Niemann-Pick's disease type C, okay, in Niemann-Pick's disease, okay, which is an autosomal recessive disorder, okay, where there's a problem with cholesterol transport. These are examples of where we see cholesterol accumulating. Cholesterol can also accumulate in cholesterolosis, okay, where there is accumulation of cholesterol in the wall of the gallbladder. These are examples of conditions where we see intracellular accumulation of cholesterol, okay? Now, proteins can accumulate also, okay? Proteins can accumulate in the kidneys, as resorption droplets, maybe in patients that have nephrotic syndrome. Okay, we can see proteins accumulating as resorption droplets. In certain diseases where cells produce a lot of proteins, and then these proteins are misfolded, particularly in certain plasmacytomas where immunoglobulins are produced, they can accumulate within plasma cells to form what we call the Russell bodies. Russell bodies. Okay, we can see proteins accumulate in these conditions. Proteins can also accumulate, okay, because of misfolding, like we had mentioned earlier in alpha-1 antitrypsin deficiency, alpha-1 antitrypsin, where these proteins, these misfolded proteins accumulate inside hepatocytes. And because they are misfolded, they cannot be released into circulation to perform their function. And so they accumulate within hepatocytes. So alpha-1 antitrypsin deficiency, we see proteins accumulate in those conditions. Sometimes there's what we call alcoholic hyaline, which is the accumulation of cytoskeletal proteins, particularly keratin, within hepatocytes. And of course, like the name implies, it is caused from alcohol. Okay, so these are some of the examples of conditions in which we see protein accumulating. Now, there are also conditions where we call protein aggregating disorders, where different proteins, accumulate within the cell. Protein aggregating diseases or disorders. Okay, so these are examples of conditions or situations where we see proteins accumulating. Now, usually there's what we call hyaline change. Hyaline change. Okay, hyaline change is simply a histologic feature that we see when different proteins are accumulated within the cell, or sometimes even in the extracellular space. We simply say it is hyaline change. So hyaline change is actually a non-specific histologic feature for protein deposition or protein accumulation. Now, when we come to carbohydrates, we know that glycogen can accumulate as a result of multiple conditions known as the glycogen storage diseases, where there are several enzyme deficiencies that lead to accumulation of glycogen within cells, particularly hepatocytes. In some conditions like diabetes, okay, in some conditions like diabetes, glycogen may also accumulate in certain cells. Okay, so these are examples of where we see carbohydrates accumulating. Now, when we come to pigments, pigments can also accumulate, and these pigments can be endogenous pigments, or they can be what? They can be exogenous pigments. Exogenous pigments. Now, exogenous pigments are simply pigments that come from outside, okay, like the name implies, exogenous. And the commonest exogenous pigment we know is carbon, which causes what we call anthracosis in the lungs. And sometimes in coal miners, it can lead to a very serious interstitial lung disease. Okay, now for endogenous substances, we have a good number of endogenous substances that can accumulate. One of them is known as lipofuscin. Lipofuscin. Now, lipofuscin is a pigment, okay, that is derived from the plasma membrane. Phospholipids, okay, is an insoluble pigment. It is insoluble and is usually yellow-brown, that is derived from phospholipids, and is an evidence of cell injury or cell stress or cell age, okay. Lipofuscin in itself is not harmful per se to the cell, but it gives us an evidence that this cell may have incurred injury at some time, or the cell is aging. And I like to say that lipofuscin is the scar of cellular injury. Okay, so that is one endogenous pigment that can accumulate, lipofuscin. Another endogenous pigment that can accumulate is melanin. Melanin. Okay, melanin, we all know what melanin is. It is the pigment that gives color to the skin for colored people. Okay, and melanin can accumulate in conditions in nevus, that's benign melanocytic lesions. It can also accumulate in melanomas. Okay, and something very close to melanin, which we know as homogentisate. Homogentisate can accumulate also. Homogentisate actually accumulates as a result of an inborn error of metabolism known as alkaptonuria. Okay, so homogentisate accumulates, and sometimes it can deposit in tissues in the joints and lead to, joint pain, and usually make the joint dark. Okay, discolor the joint, and that condition is called onchronosis. Onchronosis. Okay, another endogenous pigment that can accumulate is hemosiderin. 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 Hemosiderin will usually accumulate in cases of hemorrhage, okay, in cases of red cell lysis. Okay, we can see hemosiderin accumulate. Hemosiderin can also accumulate when there's a defect, okay, with iron metabolism. Hemosiderin is actually a storage form of iron, okay, that is derived from ferritin. okay? And hemosiderin accumulation in severe forms can lead to what we call hemochromatosis, where there's significant deposition of iron in the liver, in the pancreas, in the heart, and that can lead to serious disease. Another endogenous pigment that can accumulate is bilirubin. Bilirubin. And the problem with accumulation of bilirubin usually happens in neonates or preterm infants with neonatal jaundice, okay? And this bilirubin can find its way through the blood-brain barrier and deposit in the basal ganglia, leading to a condition known as kernicterus. Okay, so far so good. These are some of the substances that can accumulate within cell. Yes, for another exogenous pigment is the tattoo. Of course, I know that we are all familiar with tattoo. Tattoos can also, be injected into cells and accumulate within cells. But the good thing about them, at least the ones we know, is that they are inert and do not provoke inflammation. Now, having talked about intracellular accumulations, we will now discuss pathologic calcification and say a few things on cellular aging. So yes, pathologic calcification. Pathologic calcification. Okay, so what is pathologic calcification? It is the abnormal deposition of calcium, okay, small amounts of magnesium and iron in tissues. Okay, that is what pathologic calcification is. It is an abnormal, of course it will be abnormal because it is pathologic, deposition of calcium, small amounts of magnesium and iron in tissues. Okay, now there is a physiologic calcification which we already know happens in bones, but for pathologic calcification, when there is abnormal deposition of calcium inside a tissue that should not calcify, that is what pathologic calcification is. And there are two forms of pathologic calcification. Pathologic calcification can either be dystrophic, or it can be metastatic. And the major differences between dystrophic calcification and metastatic calcification include where it happens, and of course, why it happens. Dystrophic calcification happens in dead and dying tissues, while metastatic calcification happens in normal tissues. Okay? Dystrophic calcification happens because these dying tissues expose their phospholipids, as they are dying, and that will now cause an attraction for calcium and then lead to calcification. While metastatic calcification happens because of an increase in calcium levels. Okay, so in dystrophic calcification, calcium levels remain normal. Okay, because the dying tissues are the ones that simply attract the calcium. The calcium in circulation is normal, but because these dying tissues expose the cell membrane component that is necessary for calcification, and then calcium joins with them, it leads to calcification. But in metastatic calcification, calcium levels are high. Okay, calcium levels are high. And that is the reason why high levels of calcium will now interact with normal tissue and lead to calcifications. Okay, so because of that, metastatic calcification, as the name implies, can happen anywhere in the body. It can happen anywhere in the body, while dystrophic calcification can only happen in areas of necrosis or areas where tissues are already dying. Those are the major differences between dystrophic and metastatic calcification. And the reasons for increased calcium levels, okay, the reasons that calcium levels can increase and lead to metastatic calcification include when there's high levels of parathyroid hormone production, okay, so maybe as a result of hyperparathyroidism or certain conditions that lead to increased parathyroid hormone. So hyperparathyroidism is one cause. Another reason why calcium levels can go up is when there are bone disorders, maybe metastasis to the bone, or even primary bone tumors, okay, that can lead to increased calcium levels. Another thing that can lead to increased calcium levels is vitamin D related disorders. Okay. Vitamin D related disorders like hypervitaminosis D, Williams disease, okay? These are conditions that can lead to high levels of calcium. And of course, when there are renal problems, so renal failures or renal diseases, okay, can also lead to increased calcium levels. So these are the four major reasons why there's increased calcium levels, and these four major reasons can increase the risk for metastatic calcifications. Why are these pathologic calcifications a problem to us? Okay, most of the time these calcifications may not cause any problem. However, in some cases, when they happen in the valves of blood vessels, okay, they can impair cardiac function when the valves of blood vessels are calcified, okay, as a result of disease. Okay, sometimes the calcification may be so significant that they can even impair function of those tissues. For example, in nephrocalcinosis, where there's calcification within the renal parenchyma, that can lead to renal dysfunction. Now, there are several conditions where these calcifications can be seen. We can see them in papillary thyroid cancers, serous ovarian cancers, serous ovarian carcinomas. We can see them in adenocarcinoma of the lungs, We can see them in meningiomas. We can see them in mesotheliomas. We can see them in ossifying fibromas. We can also see them in medullary thyroid cancers. But for medullary, most of what we see is amyloidosis, but we can still see these calcifications there, medullary thyroid cancers. And we can also see them in adenoma of the pituitary gland. Adenoma of the pituitary, that's in pituitary adenoma. Okay, so these are some of the conditions where we can see these pathologic calcifications. And in these conditions, they appear as lamellated concentric calcifications. And these lamellated concentric calcifications are known as Samoma bodies. Okay, because they look like sand. basically on histology, psammoma bodies. And when you come here to see some of these causes that we have mentioned, you discover that is a mnemonic. Psammoma is a mnemonic for some of these causes. Okay, so that is that about pathologic calcification. The next thing we'll be talking about is cell aging, and we'll just throw a few light on cell aging, not go into details. So yeah, cell aging. The reason why organisms age is simply because their cells age. And we'll just go straight to the point to describe some of the reasons why cells age. Okay? Cells age because as the cell continues to live, it incurs DNA injury, okay, over time, and accumulation, okay, of DNA injury contributes to cell aging. Contributes to cell aging. Accumulation of DNA injury contributes to cell aging, okay? And then secondly, reduced effectiveness of the protein handling machinery of the cell. Reduced effectiveness of protein handling machinery of the cell also leads to cell aging. Okay. Of course, we know that when proteins are synthesized, they are supposed to be properly folded. And if they are misfolded, they are supposed to be degraded by the ubiquitin proteasome pathway. Sometimes even this lysosomal pathway, autophagic pathway, can also degrade proteins. However, as cells age, this machinery gets old, or this machinery wears out. Okay, so that there will be a lot of misfolded proteins that accumulate within the cell, and of course that can lead to cell death. Okay, so that is the reason why there is cell aging. Okay, another reason for cell aging is what we call the telomere attrition. Okay, telomere attrition. Okay, which contributes to what we call cellular senescence. Senescence. Okay. Now, as cells divide, cells actually have a limited replicative capacity. Cells can divide for up to 60 to 70 times, and then they enter senescence. And one of the reasons why they enter senescence is usually because of the shortening of what we call the telomeres, at the ends of DNA. Okay, so let's assume that this is a strand of DNA. At this end, there's a telomere cap. At this end, there's also a telomere cap. Okay, but as the cell divides, this cap reduces. It continues to reduce until eventually, when it has completely disappeared, or when it has reduced so significantly. Okay, by the time it reduces so significantly or even disappears, the DNA repair machinery begins to sense these two ends as breaks. And then, of course, the gene that is responsible for controlling cell cycle will ensure that this particular cell does not divide anymore, because it will sense these as breaks. Okay, so telomere attrition contributes to cellular senescence. Another thing that contributes to cellular senescence is activation of the tumor suppressor genes. Okay, tumor suppressor gene, particularly P16. Okay, when there is DNA injury, or when there's genetic injury, P16 is activated, and of course it leads to cellular senescence. One other reason for cell aging is what we call the nutrient sensing. Okay, nutrient sensing, okay, of the cell. One interesting thing is that caloric restriction, so to speak, caloric restriction okay, prolongs life. And there are some evidences that these things prolongs life, so that people, when there's a lot of intake, okay, it will inspire cell division, and of course all of these defects can happen, okay. And there are certain substances known as sirtuins, okay, which are activated in caloric restriction, and they promote cell health and encourage DNA repair and all of that. So these are some of the things that contribute to cell aging. Okay, like I said, I wouldn't be going deeply into these things, but just for us to know that there are certain substances, or there are certain situations that lead to and contribute to cell aging. So with that, we have come to an introduction or an overview of cellular pathology. In our next set of videos, we'll be talking about inflammation, and we'll be hoping that you will join us in this journey. Thank you so much for watching. I want to plead with you that if you have topics that you would like for us to treat, please write in the comment sections. Don't forget to share. Don't forget to subscribe if you have not subscribed. I will see you in the next one.